Hey everyone, Dr. Andrew Orr here. Today I'm actually going to be talking about endometriosis. So the month of March is Endometriosis Awareness Month, and it's a very important thing that we need to talk about for all women, and actually all men need to know about it as well, because often men are partners of women with this horrible disease that affects 1 in 10 women. Now, while we talk about the 1 in 10 women, those 1 in 10 women are the actual ones that have been diagnosed. And we know that it often takes up to 10 years or more to be diagnosed. So there's a lot of people that are undiagnosed and a lot of people that are misdiagnosed. And so those figures of 1 in 10 are probably a little bit skewed. There's probably at least double that, which is a little bit scary. And we do see a lot of women missed and dismissed on the way. That's a sad fact. And if that wasn't a fact, then people wouldn't take up to 10 years or more. I know some people that have taken over 20 years or more to be diagnosed. So it's a terrible thing to have to live with. Now, endometriosis is an inflammatory disease. The exact cause we really don't know much about at this stage, but there's a high likelihood, and it's more pointing towards being a genetic disorder and passed down through certain genes, and there is a hereditary aspect to it as well. We know that, you know, if your mother or your sister or someone in your family has endometriosis, there's a high likelihood that someone, like a woman, will have that disease. It's like a lot of diseases that we have genetically. They get passed down through families. Now, endometriosis can also present with other disease states such as polycystic ovaries, adenomyosis, which isn't often talked about, and I often talk about it being pretty much exactly the same disease as endometriosis, but it's just in a different location. Now, when we talk endometriosis, the one thing that I do really want to get through to women and men really across the board, and I really need people to listen to it, and this is a fact, that period pain is not normal. No matter what you've been told, the age-old myth, the passed down generations, however you've heard it, period pain, let's talking pain, is not normal. Now, I've had people say to me, but that's normal for me. I've got endometriosis, so that's normal for me. Yes, it is normal for you if you do have endometriosis, or can be. We'll talk about that in a second. But period pain is not normal. So if you suffer period pain and you've never had a diagnosis, you need to do something about it, and we need healthcare professionals to start listening to women and stop missing and dismissing them. A lot of women with endometriosis will be misdiagnosed with other issues, such as irritable bowel syndrome and issues of the bladder and so forth, or they're just told to suck it up, unfortunately. But in doing so, the longer you leave the disease there, the more catastrophic it can be. It can literally destroy organs. It can basically glue organs together. And let's not forget the reproductive aspect of the longer you leave it there either. And then the one part that we're not talking about enough is the psychological and the emotional burden that women have to endure due to the psychological, physical and emotional symptoms that they experience daily, from pain right through to all sorts of things that goes on in their body, from their bowels, their bladder, everything. It's actually shocking, and to a point that I know there's some women that have had their whole internal organs just about obliterated from the disease. Now, the disease can spread everywhere in the body. It has been found in every organ in the body. So when we talk about endometriosis, early intervention is the key to it. The earlier you get onto the causes of period pain, the better it is, the better the outcomes and the future outcomes. So I often get mothers coming in with daughters going, oh, is it too early? Is it too early? No, it's not too early. I often say, do you want to have grandchildren? Do you want to see your daughter suffer from years and years of this disease growing and multiplying and growing in their body and spreading and stuff? No, teenagers aren't too young to have it either. We've seen it now in children, you know, as young as 7 years old, and even there's even been cases that are even younger where we've found endometriosis in young girls as well. So it's catastrophic for a female. Now, when we also talk about endometriosis, endometriosis doesn't always equate to pain either. There's a significant portion of women with the disease are actually asymptomatic. And so they don't even know that they have it. And the only way that they actually find out often is just by chance, through maybe needing fertility evaluation. They end up having a laparoscopy and then they find out that they're riddled with it, or there's large pockets of it, or so forth. So it's often by chance that those ones are found. And then some women go through their whole life, not even knowing that they've got the disease, or they're being told that they've got IBS or irritable bowel syndrome, and they just live with that. And whenever I hear the word pretty much irritable bowel syndrome for a woman, I often think endometriosis, and probably 95, maybe even more percent, you know, I pretty much, what I see is 95% plus of women with irritable bowel syndrome actually have endometriosis. And as I said, they can have concurrent diseases like adenomyosis, which it's pretty much like endometriosis, but it's more confined into the deeper uterine muscles, and it'll cause more bleeding symptoms. And you can have it with polycystic ovary and all kinds of stuff. So it affects women's lives to the point that some of them want to actually give up their lives because it's not any way to live a life. And it's terrible what some women have to endure on a daily basis. So a lot of them are at home not managed, and that's the one thing that I see a lot of. The terrible thing with the endometriosis is that even sometimes when people end up having surgery, they don't often see the right surgeon because not every surgeon can deal with endometriosis. And then, you know, it does take what we call an advanced trained laparoscopic surgeon who specialises in the excision of endometriosis, and that's their specialty area, not just any gynecologist. So it's hard to explain, but you need someone that specialises, and those people are highly trained to deal with endometriosis and excise the disease properly, and they're the ones you need to see. And you're not going to always see them in the public system either, and that's a sad fact as well, that there's hardly anyone in the public system that does that sort of stuff. But even if you do, there are some private gynos that, or endometriosis excision specialists that are in the public system, but that you're not guaranteed to see them. It's a lucky dip, and the only way you can get to see those people is if you get on one of their, you see them privately and then get one on one of their public lists. But again, you could wait years to get on. You might get in a little bit sooner, but yeah, so this is the issue. And then the pain side of thing, we have a lot of people that have the surgery and then go away and have no management of the disease, which is quite terrible too, because then they've had the surgery and they think, well, I've had the surgery, it's gone. Well, it's not gone. Endometriosis is gone. The lesions that were there and the disease that was there is gone, but there's always more disease ready to be expressed. What we call the micro implants are ready to pop out. And I explain it often that it's like rust. I know people hate me talking about rust, but once rust gets into metal, it spreads. It's like, sort of like I don't like using the C word, but it behaves like that in some ways. I often explain it like a weed. You know, you pull out that weed and unbeknownst to you, you drop seeds everywhere, and next rainfall, those seeds will pop up and start growing. And that's what happens with endometriosis. You're not going to be able to see it all. The microscopic implants you can't see those. You can only excise the disease that's actually you can see with the human eye. But that does give women help, because that active disease is inflammatory, it's causing pain, it's causing lots of things. So removing that disease can help that woman exponentially. And we always say the first surgery should be your best surgery, and that's why it's important to see an excision surgeon, an advanced trained excision surgeon, not just any particular gyno. Then the management of the disease, we know that it's driven by estrogen. So, and it's not from estrogen excess. I don't want to hear people saying it's all estrogen dominance and all that kind of stuff. Women are estrogen secreting beings. And there's always going to be estrogen in their body, and so it should be too. It's from external estrogens, that we're exposed to, like chemicals and our environment, and then we've got synthetic hormones coming in, we've got plastics, preservatives, lots of endocrine disruptors, which we call environmental estrogens. So there's 87,000 that we're exposed to, from our water to plastics, preservatives, pills, detergents, God knows what. So we're exposed to it on a daily basis. And this is what happens, and this is where we're seeing expression of disease. And also then, things like diet, lifestyle and all that exacerbated, because it's an inflammatory disease. So anything that adds to inflammation from our diet, from stress, chemicals, environment, everything makes it worse. And then our gut, there's a lot of gastrointestinal symptoms and things like that, not right bacteria. We know the microbiome plays a big part in our immune system and stuff like that. And no, it's not an autoimmune disease at all. It doesn't even fit the classification of an autoimmune disease, and we've got to stop telling women that until such times that we have significantly proven that it's an autoimmune disease, which it isn't, because it doesn't produce autoantibodies, and it doesn't act on itself. It's actually normal tissue. It's actually normal tissue just growing in abnormal areas, and that's what endometriosis is. But it's inflammatory, and then it's driven by estrogen. So even small amounts of it, and you have two ovaries there that you're an estrogen secreting being. So there's lots of things that fuel endometriosis, and it's a very complex, it's a complex disease. And then we've got women sitting at home that are addicted to pain medications. And this is not having a go at those ones, because without those medications, they wouldn't be able to function daily. But the sad fact is that a lot of them are addicts. And having been on pain medications myself and been addicted to pain medication, I know what it's like to be addicted to these pain medications. And the problem is, as pain medications drop out, their life cycle starts to taper, the pain ramps up. And then you actually have withdrawal symptoms, and we have rebound symptoms and stuff like that, which are actually causing pain too. So sometimes pain's really, I've spoken about it recently in lots of other videos and stuff and blogs about pain's hard, because some pain we experience is actually withdrawal pain. But then you put the drug back in and then they start feeling better because you're actually withdrawing from the drug before. And it's a whole mechanism. But the one thing we do know is that endometriosis isn't managed very well. Finding one person that does the whole lot is very, very hard. Often we just see the surgeons will be the surgery part and then not much of the management afterwards, very few, because there's very limited options. And also in their tool bag, they've only got so many options as well, because that's the medical side of it. And you can't blame them for that, because that's all they do. That's their toolkit. But then I talk to women about, you need a multimodality approach where we look at it from every angle, and always say that you need a team approach. The only way to deal with endometriosis properly is a team approach. Now that could be using complementary medicines. We know things like acupuncture, Chinese medicines, there's herbal medicines, and prebiotics, probiotics for the microbiome. There's those things that help on that level. And I urge women to try that. Pretty much try anything that work, but you want things that have been proven to help with pain. So that's where things like acupuncture that can help with pain and assist alongside Western medicine options. So things that can assist alongside it. Then we've got pelvic floor physio. So if you do have endometriosis, often there is hypertonus through the pelvic floor vaginal area, and basically lots of spasm, and some people get vaginismus where it's that tight and that constricted. Then it can affect the bladder, so sometimes you need pelvic floor urodynamic specialist or someone that can do pelvic floor urodynamics. And then bowel, often there's the bowel involved in it as well. And then you need the emotional side. Now, anyone with endometriosis that's suffering in pain and all that should have a psychologist or some form of counselling, because you can't cope on this on your own. I know a lot of you do, and I know there's groups and stuff like that, but unfortunately, sometimes they're not equipped on an educational, medical level to actually help you. Sure, they've been through it and they understand like no one else can what you go through, but the practical application, the people that can help you, the professionals that can help you, you need to reach out to as well. You shouldn't just sit at home suffering your disease, and you need to stay in constant contact with those people. And if you don't have the right people, it's like anything, in every profession there is good and bad. It doesn't matter whether it's in medicine or it's in architecture or engineering or whatever, or lawyers, and there's good and bad in every profession, but you need to find people that specialize in endometriosis. That means on a medical level, you need a good advanced trained excision surgeon, a good advanced trained laparoscopic excision surgeon, someone that specializes in that disease. You need pelvic floor specialists, you need a counselor, psychologist, you need a good acupuncture TCM practitioner. You need, someone that can help with the bowel, like I said, the pelvic floor physio, the whole lot. You need that team approach, but find someone that's specialized, not someone that's just, well, I'm a female, so I know about this. No, you need someone that's done the training, the extra training, and really understands your disease and can help you with it. And that's where we see a lot of people going wrong. And same again, if you find a good GP, and look, a GP is a general practitioner, they're not a gynecologist, but a good GP will be able to direct you where to go and help you in some aspects with mental health plans and pain medications, and talk to and coordinate. And that's how I help people too, is more hold people's hand, care about them, walk them through it. I help them with things that I can do, and assist them to then see people that do things out of my scope of practice, like surgeons and stuff like that. But I direct them every step of the way and make sure that if I have to, I can step on toes too. I always say I'm here to keep the bastards honest. And I don't mean that in a derogatory way, but I'm there to help that person get the best care possible. And I'm there to be their guide, their protector, and look after them and make sure. And that's why in my tight network, I'm very specific who I have in my network, who I refer to, who I work with. But it is about that multimodality approach. So endometriosis is something I'm very much have a special interest in, and I've done lots of research and lots of study and looked into. And I also have loved ones that have this disease, and having been through a painful disease myself that's very similar to endometriosis, by the way, that you have the surgery and then it comes back, and then you suffer the pain and the consequences. I understand on many levels what people go through having lived with a chronic disease state, and I understand what it's like to have to rely on medications and things, but I also understand that you cannot do it on your own. And if you are sitting at home doing it on your own, you need to reach out and get professional help and find the right people. And that's what I'm here to. If you can't find, give me a call. As I said, I have 2 daughters, and I don't want to see them go through that. And I have family and people that I really love and care for that have this disease and who are part of my family. And if they're maybe watching this today, all I can say is that, you know, I love you and I will always support you and care for you and be there every step of the way for you. And that's the way I try and help my patients too, is to be there for them as that guiding person and be their guide, their protector, and hold their hand and just try and do everything you can for those people. But, you know, I understand what this disease is about. So I urge every one of you, if you can support Endometriosis Awareness Month, there's Endometriosis Australia out there that can help. There's Quendo, there's Queensland Endometriosis Association as well. There's plenty of people out there supporting it, but get behind the Endometriosis Australia, the Endo March, and let's end the silence to this disease and let's get women the help that they need, just like some of my loved ones need. And I know it's a hard journey, but I say to any woman that hasn't been diagnosed, if you do suffer period pain or irregularities or anything like that, please, please get checked. And the best thing you can do is go to your GP. If your GP won't refer you on, find another one that will, or just go in and say, I want a referral to a gynecologist, because that's what a gynecologist does. That's what they're trained to do. Don't just keep taking the pill or whatever, or masking the symptoms. Get to the bottom of it. I hope that's helped. As I said, let's end the silence for those women with endometriosis. And just remember, just because you can't see the disease and you can't see what's going on inside that person doesn't mean that that person hasn't got a world of hurt going on, and you won't know. You just won't know. They'll put on the lipstick and they'll put on a brave face, and I know my loved ones have done that. They talk about putting on the makeup and the face for the day and just to make themselves feel better. And I can understand that. I wish as a man we could do that some days when you're in pain and suffering. But yeah, let's support this amazing cause. And remember, period pain isn't normal. And I'm always here to help those with endometriosis and those that may think they have the disease. And if you're having issues with periods or anything like that, come and see me. Take care, everyone. Get behind this cause, Endo March. And let's hope that we find a cure soon, and let's end the silence for those women. Take care.